Hi, I'm Chef Jeffrey Held, and this is Cooking for Wellness at NYU Langone Health. Our guest today is Dr. Tara Shirazian, Director of our Center for Fibroid Care. Welcome, Dr. Shirazian.
Thank you for having me.
So this month we're focusing on women's reproductive health, more specifically the treatment of fibroids. So Dr. Shirazian and I collaborated on this recipe, and you'll be surprised how quickly it comes together. We got salmon and walnuts, which are high in protein and packed with heart-healthy omega-3s, and broccolini, rich in fiber, vitamin C, and antioxidants. Let's get started. Dr. Shirazian, can you tell us a little bit about what you do at the Center for Fibroid Care?
Yeah, I would love to. So the Center for Fibroid Care is a multidisciplinary center where we basically focus on fibroids. We focus on holistic management of fibroids, medical management of fibroids, surgical, and really offering women every option on how to address their fibroids for care. We even have a holistic program, and we fold in nutrition and lifestyle into all of our overall program offerings.
First thing we're gonna do is we preheated our oven to 375. We're gonna make our walnut crust now. I'm gonna go ahead and add those to the blender. We're gonna break up the walnuts just a little bit before we add the other ingredients. Just makes it a little bit easier. Pulse it a couple times. And then we have a couple of cloves of crushed garlic. We have just about a tablespoon of lemon zest and a tablespoon of lemon juice as well. Got some fresh dill and a couple of tablespoons of extra virgin olive oil. Just gonna throw a little pinch of salt in there. We want to try to blend that up here. So you want this to be, you don't want it to be pureed. You want it to be like chunky still, just kind of sticking together a little bit. I'm gonna grab our salmon. So salmon is 5 ounces a portion. So we have some Dijon mustard. We're literally gonna paint the fish with the mustard, and we're gonna use that to flavor the fish, but it helps the crust kind of adhere to the fish. Don't be afraid.
Okay.
Yeah, beautiful. Nice. So, Dr. Shirazian, are fibroids is it genetics, environmental? What is the real cause?
So fibroids are actually benign tumors of the uterus, and they're extremely common. 70% of all patients with uteri have fibroids. We do think there's a genetic component.
Is this more common in certain groups of women or populations?
It's definitely more common in Black women overall. And that's very important because it means that in that group of women, they really need to be aware that they have a slightly higher risk and that they should be looking to diagnose, pay attention to symptoms, things like that. But it does affect all races. So Hispanic women, Asian women, and Caucasian women are all likely to have it.
So we designed this recipe to really be a one pan kind of recipe. So I got some broccolini. It's basically like a hybrid of broccoli rabe, much less bitter than broccoli rabe. We have crushed garlic cloves and actually one of those red Fresno chilies right there, just sliced up. Gonna hit that just with a little tiny bit of salt, fresh pepper, and some olive oil. We're just gonna add this right to that same pan. Some sliced lemons, add those last so it doesn't take away from the green color. The acid will interact with the green vegetable. So this is gonna go into the oven. It's about 14 minutes, 375. I was curious as to where, what led you to develop the recipe we're using today.
Well, I wish I could take full credit for it. But we do have a nutritionist at the Center for Fibroid Care. I think that there's definitely a place for healthy nutrition and fibroids because what we do know is things like vitamin D seem to influence regrowth or growth of fibroids. So regrowth if you've already had them and growth if you currently have them.
Right.
And then diets that are high in estrogen, soy, may be acting as a stimulus to fibroid.
To be avoided entirely.
So we need to avoid them. And I think some of the goals were to incorporate green leafy vegetables, right? So we have the broccolini for that. You know, we talk a lot to patients about reading food labels because people use a lot of processed foods.
Sure. The only thing we used today out of a jar was the Dijon mustard. Everything else was, you know, as
everything
it grows.
is fresh.
So, Dr. Shirazian, in the spirit of just promoting awareness in general, like, what else should women know about the center?
I think it's really important that women know that they can come to our center if they have any symptoms of pelvic pain, bleeding, pressure, and they're not sure why they're having these symptoms. We are happy to see them. We see women who have all types of varying degrees of fibroids, and it's really important that they know that every option will be made available to them. We offer everything from lifestyle change, medicine, surgery, procedures. People should not feel afraid.
Okay, you ready to try our work? See if we did
so
good?
Excited.
Careful, I think it's probably still pretty hot.
Okay.
Delicious.
Excellent. You guys should definitely make this. I'm going to make it.
So thank you so much for coming. This has been great hearing your knowledge and expertise, and especially about the Center for Fibroid Care. We really appreciate you coming by.
Thank you for having me on.
Check out more episodes of Cooking for Wellness on our Healthy Lifestyle playlist.